today on successful and happy practice recorded. I'm Dr. Srikanth, consultant joint surgeon, both practicing in the UK and Bengaluru. I'm managing director of Southeast Specialty Orthopedic Center in Kavipuram, South Bengaluru, 19. And at the outset, I thank the organizer of IRACON and Heartfulness for inviting me to do this talk at the Heritage Hall in the Bangalore Palace. So these are my details. A lot of things are available on my website, srikanthkn.com. K for Kilo, N for Niagara, Srikanth SNSRIKNTH. So at the outset, I'd like to thank Heartfulness organizers for this opportunity to talk about how to design a successful medical practice in Destiny using heartfulness principles in practice. Today, I'll be talking about, a few things. One is, how to basically evolve from a competition to collaboration among doctors. Second will be, the secret to happiness decoded for doctors. And third thing will be how to deal with stress, And the last but not the least will be how to develop creativity, which is a billion-dollar question. So let us look at some of the basic facts or fundamentals in the Indian medical practice. What is happening? The reality of the medical practice in India. Medicine is a very stressful profession in India. It's everywhere in the world, but particularly in India, the stresses are more. Indian Medical Association study recently showed that Indian doctors die on the average 10 years younger compared to the general public. This is absolutely shocking. Why doctors who are supposed to be the guardians of health and making other people live should die 10 years earlier than the general public. So what is the reason? Why? Medicine itself is an uncertain science. Every test, it is done. We're in a hematology conference. We do a rheumatoid factor. It can be true positive, true negative, false positive, false negative. So there are 4 possibilities for each test. And, that makes medicine uncertain. If you go to the best centers in the world, like Johns Hopkins or go to Cambridge or Oxford, 10% of adverse events to patients is inevitable. There's no way human beings can avoid this kind of side effects or adverse effects or complications. So corruption is a big problem in the developing world. India is not immune to it, and it is said that there is boom to boom corruption in India. And you can see right from Harshad Mehta to the present scams, you can see what's happening. But the society, a corrupt society, expects doctors who are dealing with the imperfect science to be perfect. So how is this expectation correct? You are corrupt, but you want other person to be perfect. We were saying in our mother tongue, Tan Kalla Parar Namba. It means himself is a thief, but he is always pointing fingers at others, saying, you are thief, you are thief, you are looter, you are this and that kind of a thing. Forgetting that his 4 fingers, not others, are always pointing at him. That means he's doing 4 times the crime that the other person whom he thinks is doing. So this applies to everybody. So these kinds of crazy expectations, adds additional pressure on the doctors. The rampant health illiteracy, healthcare illiteracy in India, and this doesn't help. This is not just when I talk about healthcare illiteracy, it's not just a rural population or uneducated population in India who are healthcare illiterate. It's among the educated as well, who think that they know everything and they're Google doctors. The illiteracy actually is also part in the patient advocates group. Sadly, in police, they are illiterate about the health care, and in fact, police have done bloopers in the country by arresting doctors on 304, which is a murder when the patients have died because of complications. And such thing shows the healthcare literacy, and this is very rampant in lawyers and very highly educated judiciary also. Is not immune to this illiteracy. India, always baffles me as one of the rare countries in the world where the difference between a complication of a treatment and a professional negligence is not understood by the public, the media, the regulator, and even the judiciary. So I've seen a lot of cases where every complication of a surgery, the complication expected, is thought as a medical negligence. And you go to consumer court, they don't even apply, their mind or intellect. They just say, yes, it's a complication, it's a negligence, and find the doctor, and then you have to go to State Farm and pay a huge amount of money to go to State Farm and then National Forum. Then you have to go to the Supreme Court. It's just crazy. Why don't you learn properly? What is a complication? What is a negligence? And, the term gross medical negligence should be used, and only that should be penalized. So this leaves the young and the old doctor very helpless and unsupported and stressed in India. Medicine always has a unsocial work. I remember my own days as a senior house officer in the UK, where I used to work 96 hours on call, and on a Monday morning, I used to come back to my boss's OP, and I'm happily assisting from 8 o'clock list to 6 or 7 o'clock in the evening. I didn't complain. I didn't moan. The times have changed now. The juniors who don't want to do anything at the drop of the hat, they complain. They're under regulators, and this is the quality of the juniors we have. They are not fit to become surgeons after great years, which means you need to really slog long hours, and then you have to deal with stress. I was involved in an operation for 24 hours, probably the longest operation in the world in Birmingham. You ask your junior, your fellow to do it, he will collapse, he will run away, or he will probably go to the regulator, and then complain against you, the National Medical Council, that this doctor made me work for 6 hours or 10 hours in the OT. This is the quality of the people coming up. Now, a doctor feels unsupported from the patient side in India, the society, the regulator, the police. Talked about 304 and 304A. Difference everybody has to know, more particularly the police. The judiciary, sadly, less said the better. And own colleagues, due to the rampant, practice of medical jousting in India, which is not illegal and not penalized by the regulator or by the courts. It should be done. It should be penalized, and that's a way to teach lesson people who can follow the rules. And things go wrong in corporates. The management doesn't support the doctors. They wash their hands off, and the doctor has to face the music, as they say. So Indian doctor feels like an island. So it is said, used to be told that no man is island. They're there to support and things like that. You can never hear that in India. The doctor feels like an island. So being a human, he can get into other human habits like alcoholism, smoking, or sometimes even drug dependence. So these long working hours combined with these stressful activities leads to helplessness and sometimes even suicides and early deaths to the doctor. And that's why the IMA has properly said that Indian doctors die on average 10 years earlier compared to the Indian public. So what is the solution to the present problem, the problem in 2024, 2025? So here comes the role of the heartfulness. And again, I thanks the organizers for their kind gesture and giving the opportunity to talk. So basically, what is heartfulness? It is a simple definition. It's a type of modified Raja Yoga, the king of yogas. How does it work? It teaches one to bring the attention gently to one's heart. With time, it clears the mind of unwanted worries and tensions. I've been a practitioner of this method for the last 33 years, and personally, it has helped me to concentrate better as a medical student, focus, make my exams less stressful, remove fear, gave clarity of thought, and develop creativity, over decades. And the most important thing needed in 2025 for doctors to survive is creativity, because it's the era of AI. Last year I talked about AI in orthopedics and medicine, and I just put a question to the Indian doctors: will you have a job in 2 years' time, or will the AI replace you? 1,200 doctors joined, for our Meet the Master 6 meeting. So it is said that AI will not replace doctors, but doctors with AI technology will surely replace those without the AI technology. So the proof of pudding of any proof of concept, as they say, proof of pudding is in eating it. So I can give a PhD thesis on the taste of the mango, or you can taste it by putting just in your mouth. So we can experience this, heartfulness in the next few minutes. It is free, and you can't ask for more. And is it all a gloomy picture? Not really. This is a publication done a couple of days ago. So it is, as they say, hot of the press. Which are the most and least trusted professions in India? Look at doctors. 57% of the public trust doctors. Let us look at the other groups. Let's look at teachers, 56%. Let's look at judges, who judge everybody. Judge not, thou shalt not, so for thou shalt not be judged. See, only 52% of public trust the judges, while 57% of the public trust the Indian doctor. Okay, so and look at look at ordinary citizens trusting other citizens. Only 49% of the Indians are trustworthy. Remaining 51% are untrustworthy. And then sadly, the police always they take the can in any country, and 47% of the public only trust police. 53% thinks that they're draconian and things like that. They don't follow law. So not everything is lost. Still, the Indian public trust the doctors most compared to judges who judge these doctors, and also police who arrest them with 304 rather than 304A. And 304 is illegal as far as a doctor-patient relationship is concerned. So, thank you very much for your patient listening. And soon in December we'll be starting a course for all the orthopedic patients in India. That is called as a joint guru program in India. And if there are junior doctors in orthopedics, I'll be starting a mentorship and the online fellowship program. And we just launched the AI-enabled digital doctor program last week. And for those people who are suffering in pain, and the world is hurtling towards World War III, anxiety. So I'll be launching a spiritualism channel and these kinds of secrets of happiness course, which is the most needed thing in the world right now in 2025, as the world hurtles towards probably a nuclear catastrophe if we don't change ourselves. And then for those who are Tariq per Tariq victims, so sadly there's 60, I believe half of the Indian population are justice delayed is justice denied kind of victims. And for them, trying to find instant solutions with the help of my legal team who works with me. Thank you very much for the patient listening. Bye-bye.